Hi, I'm Liz.
Hey, I'm Lindsay.
I'm Rosa.
I'm Juan.
And we did our group project on interprofessional communication issues within the Inpatient Addiction Center Setting. The following examples we've given you are just a few of the many communication errors that can occur within this setting. Enjoy.
So, Sally, you've been on the program now for about 8 weeks, 8 sessions. Tell me a little bit about how you're feeling.
I've been feeling pretty good. You know, the regimen that I've been on has been working pretty well for me. I have good days and bad days, but I think I'm at that point where I'm ready to start maybe trying some alternative therapy.
Oh, sure. We have like art therapy, music therapy, pet therapy. Those are good non-pharmaceutical types.
Yeah.
I know that you're on the methadone therapy too.
It has been working for me, but you know, it does kind of make me tired a lot. So I think trying something different to kind of keep me distracted during the day would really be helpful. So if I could get into that, you know, with Dr. Smith's approval, that would be really cool.
Okay, so we're gonna go inside and I'm gonna try to put in the order.
Okay, cool.
Hopefully the doctor's there so he could log me into the system.
Sounds good. Thanks, Coach Liz.
All right.
I appreciate it.
No problem.
Okay.
Oh shoot, I still don't have access to her file. Maybe I'll call the doctor and see if he can put it in. Hello? Voicemail. I'll try later.
Okay.
Listen, I don't know. It's just crazy. I can't pick a side right now.
What do you mean both sides?
What was that again?
What do you mean both sides? Are you taking her side or his side?
I love
You
Johnny
have to
Depp.
pick.
You saw his part in Pirates of the Caribbean? Oh
Yeah.
my goodness. It was, oh my, there they go again. It's the coach from
Are you
Real Hondo Rehab.
That's important, right?
It could wait, no worries. What were we talking about? Johnny Depp?
Yes.
All done with rounds. Let's see here. Alrighty, Miss Sally. Man, I probably should answer the phone earlier and get an update on her. Alright, it's fine. We'll just continue with her methadone. That should be fine.
Since the rehab counselor is unable to access the patient's EMR, she is unable to document that Sally is open to other methods of therapy, most importantly non-pharmaceutical methods. She is unable to reach the healthcare provider to convey this, and without follow-up, the HCP continues to prescribe Sally methadone. She has stated that she wishes to try an alternative form of therapy since the methadone makes her very tired. Some possible solutions for this scenario could be 1. More accessible forms of communication regarding the patient or team interactions, and 2. More education and advocacy for alternative forms of therapy. Lori Ross states in her research article that client participants expressed frustration with what was perceived as a rush to prescribe medication despite client preferences for talk therapy. She continues on to state both clients and service providers stress the importance of support workers in their healthcare. However, the lack of communication and collaboration between health professionals is a major barrier to the quality of care for people living with substance abuse issues. Okay, hey there, I'm Dr. Smith. I'm here for Rosa. Are you Rosa? Okay, so I'm going to prescribe her some more meds, but I need to know what she's allergic to. Do you know what you're allergic to?
¿Le digo de que eres alérgica?
Sí.
Yo sé de que eres alérgica. Okay. Sí, es alérgica a naproxen.
Naproxen? Okay.
She's allergic to naproxen, I'm sorry.
Okay, yeah, so allergic to naproxen. Great, I'm going to put an order for some meds. I'll be back later. Okay?
Okay, thank you.
Yeah.
Hello?
Hey, is this pharmacy?
Hey, Doc.
Okay, cool. So this is Dr. Smith. I'm going to put in an order for Rosa Garcia in bed 73.
Okay, so you want to put in the order for this patient? Okay, Rosa Garcia.
She's going to get naltrexone twice a day, okay? All right, thanks, bye.
She's going to be receiving naltrexone. All right, I got it right here. All right, just let me repeat the order back to you. Hello? Hello? All right, Rosa Garcia, naltrexone. This milligrams. All right.
The healthcare provider does not use a certified translator to communicate with the patient and instead relies on the family member to translate. Since the family member does not have any medical background, she miscommunicates an incorrect patient allergy. The patient is indeed allergic to naltrexone, not the naproxen that the family member states. The healthcare provider's lack of diligence will lead to a med error.
There are two possible solutions that could impact this scenario. The doctor could create a better relationship with this patient. Like Kevin Wu discusses in his article, Patient Communication and Substance Abuse Disorders, there are both verbal and nonverbal communication errors that present in these situations. This provider's uninterested interaction with this patient, as well as not taking the time to use a translator service, has greatly affected the outcome of this patient. Treating the patient with respect and dignity can go a long way towards helping them during their recovery. The second possible solution is the doctor needs to use an official translator. As stated in our leadership textbook, breakdown in communication attributes to up to 50% of preventable medication and medical errors.
The number you have dialed has been changed.
Nurse,
Garcia?
sir,
Yes,
please,
Mr.
please.
Rodriguez.
It's time for my Norco. I need it now.
It's due
No.
6:30
It's due
p.m.
now. It's due now, please. I
Look
know
at the
it's due
clock.
now.
It's only 6.
It's due
So you
now.
gotta
No,
come
it's not.
down, okay?
No, it's not. It's due now. I'm not addicted
It's
to it.
not due,
I
so-
promise. I'll
okay,
pay
I
you.
check
Give
back
it
with
to me,
you. I check
please.
back with you.
Please.
Okay, Ms. Garcia, I have your naltrexone. Is that okay with you? It's a new med the doctor prescribed for you. For your
Okay,
pain.
se me hace mal la medicina.
¿Está bien? It's
Sí.
good? Okay, good.
Yes.
Perfect. So I'm just gonna scan your armband
Yes.
and we're all good, okay?
Yes,
Yes, okay. Okay, good. Thank you.
yes.
Okay. Yes.
The nurse did not check for an allergy band, nor did she double check the computer for any allergies. Due to the language barrier and lack of due diligence to obtain the iPad translator, she did not appropriately assess for allergies. This patient is in fact allergic to naltrexone, but because of several holes in communication, it has been missed. According to a study done by the Mayo Clinic in 2014, 7,000 to 9,000 patients die from a medication error in the United States every year. A solution to the scenario would be to use an official translator service, whether it be iPad or telephone, to best ensure that not only the patient understands us, but that we understand what the patient is saying too. A translator service may not be the cheapest approach, but like Sam Slade states in his article, patients' lives may literally depend on clear communication.
So I have Mr. Rodriguez, room 303. He's full code. He has no allergies, and he has a history. So he got into a car accident. He had low back pain. So now he's just an addict. He's just taking. He acts crazy. I had to put things on him. He won't wait until the time is due. So
Okay, is there an order in for those? Do you know?
I think there was one. So I just gonna put it in.
Okay,
Yeah,
got
just,
it.
just double check. But I
Okay.
remember the doctor saying something
When
about
was the last time you checked like cap refill and stuff?
it. I did the morning assessment. Yeah, so that was early.
Okay,
Mhm.
got it.
Okay.
Okay, great, thank you.
Yeah.
While giving a report, the departing nurse passes judgment on the patient, referring to him as a drug seeker. Due to her assumption, she has not properly assessed the patient's pain. She also has a questionable order for restraints, nor has she done the appropriate checks for a patient in restraints. The oncoming nurse will need to assess the patient thoroughly and prioritize checking the restraint order so that the patient is not being falsely imprisoned.
This scenario could be addressed by better educated nurses and providing support through organizational change. This can be achieved through role adequacy and role legitimacy. As stated in an article by Gabriel Horner, giving nurses a tool to not just learn about addiction, but also empower those struggling with addiction can have a dual provider-patient benefits. There is a consistent positive correlation between healthcare workers' attitudes towards patients disoriented drug use and their degree of familiarity with substance use problems. Increased contact with this group and more confidence in treatment.
Okay, well, have a good day.
Okay, I'll see you. Bye.
Hello. Hey, Mr. Rodriguez. My name's Lindsay. I'm going to be taking over for Rosa. How's it going?
She didn't adjust my pain last night.
Okay, I got you. Let me just double check your wristband here. Okay, great. So, what's your pain level right now on a scale of 0 to 10?
It's always a 10.
Always a 10?
It's always 10.
Okay, yeah, I saw you had a history of that car accident. You had some back pain from it. So,
Yeah.
let me go ahead and check your vitals.
She accuses me of being an addict. I'm in pain.
Yeah.
I need my Norco.
Okay, I understand. I'm sorry about that. Let me check your vitals real quick, and then I'll see what we can do about your pain meds, okay?
Okay.
Shoot, your blood pressure and heart rate are kind of high. You know, it seems like you are in some pain. So,
Yeah.
let me go check on that order real quick, okay?
All right, thank you.
Okay, I'll be right back.
Thank
Okay.
you.
Okay, so I see the order for pain meds right here, 10 out of 10 pain, okay, and he's due now. Shoot, I'm not seeing an order for the restraints. Oh, crap.
crud. Now I gotta call Dr. Smith about that. Shoot. Okay. Let me go get him his pain meds. Okay,
You
Mr.
back?
Rodriguez. Yeah, I'm gonna take this off real quick so you can take the Norco, okay?
Okay. Do you guys even talk to each other? I've been in pain this whole entire time. The
Yeah.
night shift, day shift. Does the doctor even know about this? Do you guys even talk to them?
Yeah.
Like, this is not what I signed up for when I came to rehab. Like, come on.
I know. I understand your
All right.
concern.
Okay, that's
I'm
fine.
very sorry.
That's fine. I just want my Norco.
Yeah, no problem.
Go.